question. If you want, I can make more like this. This is a question. A 37-year-old man is brought by his partner due to concerning sexual behavior. Now, the age is important, 37. Most likely diagnosis, question mark. He reports intense arousal from secretly watching neighbors undress. He has installed hidden cameras and has done this repeatedly for 1 year. He denies any distress. What is the most likely diagnosis? Paraphilia, voyeuristic disorder, OCD, antisocial personality disorder, no diagnosis. What do you think could be the answer?
Voyeuristic disorder, sir.
Okay. Best next step in the management. He is worried about legal consequences but says he can't stop. A. Reassurance, psychotherapy plus SSRI, immediate anti-androgen therapy, antipsychotics, no treatment unless distressed. What's the most likely treatment? अगर voyeuristic है,
B. Psychotherapy plus SSRI.
okay, very good. Question number 3. If behavior escalates, continued offenses despite SSRI. Next step. Increased SSRI indefinitely. Add a benzodiazepine. Start anti-androgen therapy. Discontinue treatment. Electroconvulsive therapy.
Start anti-androgen therapy.
Very good. पाकिस्तान में एंटी एंड्रोजन थेरेपी कौन सी अवेलेबल है?
नहीं सर, इसका आइडिया नहीं है.
Anybody has an idea? Cyproterone, which was given historically for a long time for these kind of individuals. Cyproterone. Is it available in Pakistan? Okay, it's available. Surprisingly, I have never used it in Pakistan, but Zafa वालों का एक्नॉट के नाम से अवेलेबल है. Diane 35 females को जो दी जाती है बायर वालों की, that is definitely available. And Femstil 35 or Hydrate C, all 4 brands are available. So it is available in Pakistan. Diane 35 is the common name. Gynecologists females को देते हैं for multiple hormonal disturbances. और मेल्स को अगर दें एंटी एंड्रोजन्स तो ऑब्वियसली वो केमिकल कैस्ट्रेशन के बराबर है. Now there are other forms available. This was injectable. It has multiple side effects. यहाँ पे मेरे बहुत सारे पेशेंट साइप्रोटेरोन पे. I never prescribed it. Special sexual clinics में prescribe होता है और खासतौर पे sexual offenders को दिया जाता है. Because of the rules and regulations are very strict, number of patients here are caught seeing pornography of underage girls or boys, और उन लोगों में ये खास तौर पे ट्रीटमेंट इनिशिएट किया जाता है यहाँ पे सेक्सुअल ऑफेंडर्स के लिए. So this is one of the MCQ, which is an example of TOS, right? Now coming back, so we were supposed to cover 2 subjects, dementia and paraphilias. I'll be starting with dementia first. A 68-year-old man presents with progressive cognitive decline over 2 years. His wife reports early personality changes, disinhibition, compulsive eating behaviors. Memory is relatively preserved in early stages. MRI shows focal atrophy predominantly in frontal lobes. Which of the following is most likely diagnosis? It's not very difficult. Alzheimer's, vascular dementia, frontotemporal dementia, Lewy body dementia, Parkinson's disease dementia.
Frontotemporal dementia.
Frontotemporal dementia, because the memory is relatively preserved at this point in time. but there is progressive cognitive decline, disinhibition, and compulsive eating. So frontotemporal is the right answer. Good. A 72-year-old woman has fluctuating cognition, recurrent, well formed visual hallucinations, and mild Parkinsonism. So, three: fluctuating cognition, visual hallucination, Parkinsonism. She develops severe rigidity after being given haloperidol. What is the most likely diagnosis?
Dementia with Lewy bodies.
वेरी गुड शाबाश जिस पे प्रॉब्लम नहीं है मैं आगे जा रहा हूं. A 65-year-old man presents with stepwise cognitive decline following multiple transient ischemic attacks. Examination reveals focal neurological deficits. Which mechanism best explains his condition? Beta amyloid plaque deposition, tau protein hyperphosphorylation, chronic cerebral hypoperfusion and infarction, alpha synuclein accumulation, prion protein misfolding.
Chronic cerebral hypoperfusion infarction.
Good. So this is not difficult. It's, as you see, stepwise cognitive decline usually occur in
Vascular dementia.
vascular. Exactly. A patient with dementia develops myoclonus, rapidly progressive cognitive decline, and characteristic EEG finding, periodic sharp wave complexes. What is the diagnosis? Alzheimer's, Creutzfeldt-Jakob, dementia with Lewy body, frontotemporal dementia, normal pressure hydrocephalus.
Creutzfeldt-Jakob disease.
Very good. इसमें भी again problem ज़्यादा नहीं है. I haven't seen a case of Creutzfeldt-Jakob disease in my life, so I cannot comment on it. It's a theoretical question. But myoclonus, a typical changes and EEG changes are seen in Creutzfeldt-Jakob disease. Number 5, a 75-year-old presents with memory loss and difficulty learning new information. He is 75. MRI shows hippocampal atrophy. Which neurotransmitter deficiency is mostly associated? Dopamine, serotonin, acetylcholine, GABA, glutamate.
Acetylcholine.
Acetylcholine. Very good. A 70-year-old woman presents with gait disturbances, urinary incontinence, cognitive impairment. 70 years, gait disturbance, urinary incontinence, cognitive impairment. CT shows enlarged ventricles without cortical atrophy. What is the best next step? Start donepezil, start levodopa, lumbar puncture with large volume CSF removal, brain biopsy, antipsychotic therapy.
Lumbar puncture with large volume CSF removal.
क्यों?
NPH case है. Normal pressure hydrocephalus.
Good. Shabash. A 74-year-old man presents with cognitive decline and Parkinsonism. His symptoms began with tremor, rigidity for 3 years before memory impairment. He now has executive dysfunction and visuospatial deficit. What is the most likely diagnosis? Alzheimer's, dementia with Lewy body, Parkinson's disease dementia, frontotemporal dementia, progressive supranuclear palsy.
Parkinson's disease dementia.
Parkinson.
Good.
Parkinson disease dementia.
So these are relatively easier and common problems, so it should not give you the problem. A patient with suspected dementia with Lewy bodies becomes agitated and given a typical antipsychotic. Shortly after, he develops severe rigidity, confusion, autonomic instability. What is the next step? Increase antipsychotic, switch to haloperidol IM, stop the antipsychotic immediately, start benzodiazepine long term, begin levodopa.
Begin levodopa.
Nope.
Stop the antipsychotic immediately.
Yes. First step is to stop the antipsychotic, which is the culprit of developing these symptoms. Only then you will be able to proceed furthermore. A 69-year-old woman presents with memory impairment, depression, and slowed thinking. तीन चीजें, memory impairment, depression, slowed thinking. Labs show macrocytic anemia, which is the most likely underlying cause. Folate deficiency, B12 deficiency, iron deficiency, chronic kidney disease, hypothyroidism.
Folate deficiency, iron
Vitamin
deficiency.
B12.
एक ने बोला विटामिन B12, एक ने बोला फोलेट. फर्म दोबारा से एक आंसर, फोलेट और B12. मैक्रोसिटिक एनीमिया किसमें होता है?
Iron deficiency and
आयरन डेफिशिएंसी में माइक्रोसिटिक होता है.
फॉलिक एसिड में.
एग्जैक्टली. आयरन डेफिशिएंसी एनीमिया माइक्रोसिटिक होता है. मैक्रोसिटिक विटामिन B12 डेफिशिएंसी में होता है. थोड़ा सा ध्यान से, ठीक है. MRI of a patient with dementia shows asymmetric atrophy of the temporal and parietal lobes. Asymmetric atrophy of temporal and parietal lobes, especially in the hippocampus. Which pathology is most likely? Alpha-synuclein inclusions, prion protein deposition, beta amyloid plaques and taut tangles, vascular infarcts, TDP-43 inclusion in frontal lobe. Asymmetrical atrophy, temporal or parietal lobe, especially in hippocampus.
B amyloid plaques.
Absolutely. Actually,
Alzheimer's
it's
disease.
beta amyloid plaques and taut tangles, C. आपने बी बोला लेकिन आंसर ठीक था. इट्स सी, राइट? ओके, ठीक बोला आपने, लेकिन उसको सी को करेक्ट करना, गलती ना करना. Which feature most strongly differentiates dementia with Lewy bodies from Alzheimer's? Lewy bodies and Alzheimer's difference. Memory impairment, gradual onset, visual hallucination, age of onset, language dysfunction.
Visual hallucination.
Very good. Visual hallucination is the correct answer. Why? किसमें होती हैं visual hallucinations?
Frontotemporal dementia.
Which is Lewy body dementia. Good. A 73-year-old woman with mild to moderate Alzheimer's disease is started on treatment. Which of the following is the most appropriate first-line medication? Memantine, haloperidol, donepezil, levodopa, valproate.
Donepezil.
Donepezil. Okay, they are easy. Good. A 69-year-old man with early Alzheimer's disease is started on donepezil. After several weeks, he develops syncope. Which of the following mechanisms best explains this adverse effect? NMDA receptor antagonism, increased vagal tone leading to bradycardia, dopamine receptor blockade, GABA receptor potentiation, serotonin reuptake inhibition.
Increased vagal tone leading to bradycardia.
Absolute. क्यों? donepezil choline esterase inhibitor है, और choline esterase inhibitor वेगल टोन को जो है वो इंक्रीज करके ब्रैडिकार्डिया कॉज कर सकती है. Careful. A patient with moderate Alzheimer's disease is taking choline esterase inhibitors. Memantine is added. Moderate to severe form of dementia में हम पहले choline esterase inhibitors देते हैं, और अगर इफेक्ट ना आ रहा हो तो मेमेंटीन ऐड करते हैं. What is the primary mechanism of memantine? Irreversible inhibition of anticholinesterase, competitive antagonism of dopamine receptors, non-competitive NMDA receptor antagonism, inhibition of beta amyloid aggregation, tau phosphorylation blockade.
Non-competitive NMD receptor antagonism.
Oops. फिर सोचो ध्यान से. एक चांस और. This is the catch in this MCQ.
तो सी ही नहीं, मेमेंटिन का पूछ रहे हैं ना. मोमेंटम का
Momentin
पूछ रहे हैं।
non-competitive, NMDA receptor antagonism. Is it non-competitive?
सर एनएमडी एंटागोनिस्ट तो है, नॉन कॉम्पिटिटिव का नहीं पता।
हाँ, बस यही कैच है, इसलिए आपने गलती कर दी। नॉन कॉम्पिटिटिव एनएमडीए रिसेप्टर एंटागोनिज्म, वो नॉन कॉम्पिटिटिव कह रहा है, जबकि एक्चुअल इज इनहिबिशन ऑफ बीटा एमिलॉइड एग्रीगेशन। कॉम्पिटिटिव एनएमडीए रिसेप्टर एंटागोनिज्म, एक छोटी सी चीज से एमसीक्यू ट्रिकी हो गया, इसलिए अगेन कहते हैं एमसीक्यूज में इस लेवल पे एवरीबडी नोस कि वो एनएमडीए रिसेप्टर एंटागोनिज्म है, ठीक है, लेकिन वो नॉन कॉम्पिटिटिव है, दैट इज मोर इंपॉर्टेंट। सो वहां पे वो निगेट हो रहा है। Which inactive factor is most strongly associated with late onset Alzheimer's disease? Late onset Alzheimer's disease, genetic factor. APP mutation, presenilin 1 mutation, presenilin 2 mutation, ApoE4 allele, tau gene mutation.
ApoE4 allele.
This is easy too. ApoE, we all know. किताबों में सब बहुत prominently लिखा हुआ है, so that is the answer. A 74-year-old woman with Alzheimer's disease is treated with donepezil. She develops persistent nausea, diarrhea, and weight loss. Her family asked about switching therapy. Which of the following is the best next step? आपने cholinesterase inhibitor donepezil दी, वो काम नहीं कर रही, पेशेंट को साइड इफेक्ट हो रहे हैं, विच इज द नेक्स्ट स्टेप? डिसकंटिन्यू एंड स्टार्ट मेमेंटीन मोनोथेरेपी, स्विच टू राइवास्टिगमिन ट्रांसडर्मल पैच, add lopromide and continue donepezil, reduce dose and add haloperidol, switch to valproate.
सर होना तो रिवास्टिगमिन चाहिए, लेकिन ट्रांसडर्मल पैच में तो आई थिंक वो नहीं देते टैबलेट फॉर्म में। तो
बी
है। Transdermal patch is the safest option if the person is developing gastric problems with any of the drugs, right?
सर
Because
पाकिस्तान में आई थिंक नहीं अवेलेबल ट्रांसडर्मल पैच।
बिल्कुल अवेलेबल है, वो पहले तो बिल्कुल फ्रीली अवेलेबल था, अब जरा शॉर्टेज हो गई है, लेकिन मिल जाता है, ढूंढना पड़ता है। 10 मिलीमीटर्स का पैच है, 9 मिलीग्राम्स की डोज है, रिलेटिवली अ सेफर ऑप्शन है, एंड थियोरेटिकली स्पीकिंग इट इज द चॉइस, राइट? अब अगर नहीं मिलता पाकिस्तान में, तब भी थ्योरी नहीं चेंज होगी। A patient with Alzheimer's disease is enrolled in clinical trial targeting beta amyloid. Which of the following mechanism best explains how monoclonal antibodies, for example, aducanumab-like therapies are thought to work? Increase acetylcholine release, block NMDA-mediated excitotoxicity, promote clearance of extracellular amyloid plaques, prevent tau phosphorylation, and enhance synaptic dopamine.
सी promote clearance extracellular amyloid plaques.
क्यों?
सर बात की ऑप्शन तो
बाकी की ऑप्शंस कैसे गलत हैं? बस ये बता दो तो आंसर सही है। यू आर राइट, आंसर सही है, लेकिन इसको क्यों चूज किया? बाकी गलत क्यों है?
सर फर्स्ट ऑप्शन इसलिए कट हो रहा है क्योंकि एसिटाइलकोलिन इनहिबिटर दे रहे हैं, तो वो तो डिक्रीज करेगा, इंक्रीज नहीं करेगा।
ओके गुड। दूसरा
एनएमडी
एनएमडीए
का उसका
उसका कोई रोल नहीं है कोलिनेस्टरेज इनहिबिटर्स के साथ, लेकिन वो कह रहा है कि क्लिनिकल ट्रायल टारगेटिंग बीटा एमिलॉइड। आंसर ठीक है आपका, प्रमोट क्लियरेंस ऑफ एक्स्ट्रा सेलुलर एमिलॉइड प्लैक्स, aducanumab like therapies help in clearing amyloid plaques. क्लिनिकली अभी तक कोई ऐसी दवाई मार्केट में नहीं है जो अवेलेबल जो ये कर दे, क्योंकि उनकी अनफॉर्चुनेटली प्रॉब्लमेटिक साइड इफेक्ट्स बहुत ज्यादा हैं। बट आंसर करेक्ट है आपका, थोड़ा सा बाकी डिटेल से देख लेना। A 76-year-old woman with progressive cognitive decline undergoes MRI showing hippocampal atrophy. Common problem. CSF analysis shows decreased alpha beta 42, and increased phosphorylated tau. What is the earliest pathological event in this disease? 1. Synaptic loss, tau aggregation, amyloid deposition, neuroinflammation, cholinergic neuron death. कोई भी नहीं. Come on.
Sir,
Amyloid.
Amyloid deposition. That is the correct answer. C. ठीक है. Synaptic loss, usually it comes late. सबसे पहली चीज जो MRI पे आती है, जो powerful MRIs in these days, they show amyloid deposition. So that is one of the findings. If visualization is accurate and MRI is a good one. Which of the following best distinguishes Alzheimer's disease from frontotemporal dementia early with the course? Apraxia, memory impairment, executive dysfunction, behavioral inhibition, language impairment.
behavioral disinhibition.
Behavioral disinhibition? नहीं. वो कह रहा है कि early signs. Which of the following best distinguishes Alzheimer's from frontotemporal? Frontotemporal में ज्यादा कंपोनेंट क्या आ रहा है? आप लोगों ने पहले भी बताया.
B.
B. Memory problem is coming first, it is Alzheimer's. Motor component coming first, it is Lewy body. A patient with Alzheimer's disease is noted to have significant impairment in naming objects, which is called anomia, right? But relatively preserved memory early in the disease. Which variant is most likely? Posterior cortical atrophy, logopenic primary progressive aphasia, behavioral variant of frontotemporal dementia, semantic dementia, vascular dementia. लोगोक्लोनिया क्या होता?
Repetitions हो रही होती है.
किसमें होती?
Fronto.
Come on. Anybody? Alzheimer's disease noted significant impairment in naming objects. So naming
Vascular
objects.
dementia. Vascular.
Huh?
Vascular dementia.
नहीं. Logopenic, उससे connect करें ऊपर से. Significant impairment in naming objects, which is logopenic. Primary progressive aphasia. Alzheimer disease का diagnosis means generalized सारा चल रहा है सिलसिला. वेरिएंट उसका पूछा जा रहा है जिसमें लोगोपिनिक नेमिंग ऑब्जेक्ट्स जो नोमिया और उससे रिलेटेड चीजें पैराइटल लोब के हिस्से की, दैट इज वन ऑफ द प्रॉब्लम्स. लोगोपिनिक प्राइमरी प्रोग्रेसिव एफेजिया थोड़ा सा मुश्किल है. ओके. A 34-year-old man reports recurrent intense sexual urges involving exposing his genitals to unsuspecting strangers. He feels tension before the act and relief afterwards. The behavior has persisted for 8 months and caused legal problems. Which is the most likely diagnosis? Exhibitionism, voyeuristic disorder, sexual masochism, antisocial personality, impulse control disorder. इनमें से 3 में ये फीचर होता है, लेकिन इस पेशेंट में 34 साल जवान आदमी, क्या प्रॉब्लम?
A.
A. Exhibition.
E.
Exhibitionist disorder में लीगल नहीं होता. कौन सा?
E.
See,
Impulse control.
sexual.
Impulse control बोल रहे हैं.
C. Sexual masochism disorder.
Sexual masochism disorder. नहीं, सुफियान साहब ठीक कह रहे हैं. Exhibition disorder है, because he comes, he exposes, and then he disappears. The behavior persists for 8 months and that causes legal problems. फिर उसके पीछे भागा जाता है और वो disappear हो जाता है. So they are careful not to be caught, right? That is what they do usually, and that is exhibitionist disorder. Confuse नहीं होना, मैं confuse कर रहा हूँ, sorry. A 29-year-old man is sexually aroused by secretly watching others undress. He has never been caught and reports no distress or impairment. कभी पकड़ा नहीं गया, कोई डिस्ट्रेस नहीं है, कोई इंपेयरमेंट नहीं है, लेकिन लोगों को अनड्रेस करते हुए सेक्सुअल अराउजल हो रहा है. सिम्टम्स हैव बीन प्रेजेंट फॉर 1 year. What is the most accurate diagnosis? Voyeuristic, paraphilia, OCD, adjustment, no diagnosis.
A.
voyeuristic,
Voyeuristic. 29 साल, sexually aroused by watching people, no distress, no impairment. In voyeuristic disorder, there is a distress and there is an impairment as well. When there is no distress and no impairment, then it is what?
I think voyeuristic ही होगा.
नहीं, voyeuristic में डिस्ट्रेस होता है, वो करके बाद में उसको फीलिंग होती है वो ये गलत करती है, नहीं करना चाहिए था. इवन वो असेसमेंट भी जब आपकी हो रही होगी तो उसको गिल्ट फीलिंग हो रही होगी, या वो मलामत कर रहा होगा कि नहीं करना चाहिए था, बुरी बात है, लेकिन कर दिया, रुका नहीं.
सर अगर इसको लीगल इसकी वजह से प्रॉब्लम आ जाती है तो वो भी हम डायग्नोज नहीं करेंगे.
अगर वो खुद डिस्ट्रेस नहीं है और इम्पेयरमेंट नहीं, इम्पेयरमेंट का लफ्ज भी साथ में है ना, क्योंकि आईसीडी में और डीएसएम में आप तो इम्पेयरमेंट को बहुत क्लिनिकली सिग्निफिकेंट रखते हैं. सो इट इज पैराफीलिया बट नॉट अ डिसऑर्डर. है पैराफीलियाज में, बट इट्स नॉट अ डिसऑर्डर बिकॉज ना डिस्ट्रेस है ना इम्पेयरमेंट है. और क्लासिफिकेशन सिस्टम में ये दोनों चीजें होना जरूरी हैं, सोशल एंड ऑक्यूपेशनल डिक्लाइन, डिस्ट्रेस और इम्पेयरमेंट. राइट, सॉरी, ये थोड़ा सा ट्रिकी है, मुश्किल नहीं है, ट्रिकी है. A 41-year-old man is distressed by recurrent urges to be humiliated and bound during sexual activity. He only engages in these behaviors with a consenting partner, but feels significant shame and impairment. What is the diagnosis? Sexual masochism disorder, sadism disorder, fetishistic disorder, no diagnosis, gender dysphoria.
Asexual masochism disorder.
वेरी गुड, ठीक है, आगे चल, मेरा सिर्फ बीच में रह गया. विच ऑफ द फॉलोइंग इज द मोस्ट अप्रोप्रिएट फर्स्ट लाइन फार्माकोलॉजिकल ट्रीटमेंट फॉर अ पेशेंट विद पैराफिलिक डिसऑर्डर who has significant compulsive sexual urges but no violent behavior? Haloperidol, fluoxetine, lithium, clozapine, valproate.
Fluoxetine.
Good, fluoxetine. Impulse control के लिए first line treatment is fluoxetine. A 38-year-old man with pedophilic disorder has a history of acting on urges. Which of the following is the most effective pharmacological treatment to reduce recidivism? Buspirone, testosterone replacement, medroxyprogesterone acetate, bupropion, mirtazapine.
Sir, C.
सी. सी क्या है? अभी ऊपर लफ्ज यूज किया था, क्या था वो? मेड्रॉक्सीप्रोजेस्टेरोन एसीटेट क्या करती है मेल्स में?
प्रोजेस्टेरॉन ज्यादा करेगी बॉडी.
तो उससे क्या होगा? मेल्स में क्या होगा? अच्छा चलो पढ़ लेना. Anti-androgen therapy. A patient derives sexual arousal exclusively from non-living objects, for example, shoes, for more than 6 months, but reports no distress and normal functioning. What is the most accurate classification? Fetishistic, paraphilia, OCD, delusional disorder, no diagnosis.
फिर no diagnosis.
नहीं, ऊपर भी मैंने बात की थी कि पैराफीलिया लेबल हो जाएगा बट डिसऑर्डर नहीं है. सो पैराफीलिया, नो डिसऑर्डर. सो अगर
Okay,
आप
ठीक.
तो डिस्ट्रेस नहीं है, नॉर्मल फंक्शनिंग है, तो है पैराफीलियस, बट इट्स नॉट अ डिसऑर्डर। डिसऑर्डर लेबल तब करेंगे जब वो डिस्ट्रेस या फंक्शनिंग इंपेयरमेंट आएगी। ठीक है, ये थोड़ा सा
ठीक।
क्लासिफिकेशन के हिसाब से ट्रिकी एमसीक्यूज है। A 45-year-old man experiences sexual arousal from inflicting psychological suffering on others and has acting on these urges non-consenting individuals. What is the diagnosis? Masochism, sadism, antisocial, conduct, paraphilia only.
सैडिज्म।
Good. ये sadistic behavior है, especially when non-consenting individuals, then it is more problematic. और इसमें legal issues बहुत ज्यादा commonly आते हैं, right? Which brain neurochemical mechanism is the most implicated in the compulsive aspects of paraphilic disorders? Compulsive aspects of paraphilic disorders. Dopamine excess in mesolimbic pathway, serotonin deficiency leading to poor impulse control, acetylcholine deficiency, GABA excess, glutamate deficiency.
Serotonin.
Absolutely. इसीलिए fluoxetine is considered to be a good treatment for these individuals. A 52-year-old man with paraphilic disorders fails SSRI therapy and continues to have high-risk behaviors. What is the next step? Benzodiazepine, anti-androgen, benign stimulant medication, ECT, switch to antipsychotic.
बी।
Anybody?
Anti-androgen.
Absolutely. Anti-androgen therapy. Again, because we don't practice this in Pakistan, so we are not familiar with it. Even coming to this country and practicing it, I see people around me giving anti-androgen therapies to sexual offenders. Very commonly here, very common. At least seen in 1 in 100. So it's relatively common. Like there are certain disorders which I haven't seen in my life, like Creutzfeldt-Jakob. So this is something tricky, and you should be clear about it that this is what is used commonly. A 33-year-old man reports intense sexual arousal from secretly recording strangers in the changing rooms. He has done this multiple times over the past year. He denies distress and states it's just exciting. What is the most accurate diagnosis? Paraphilia, voyeuristic, antisocial, impulse control, no diagnosis.
Paraphilia.
Good. वैसे ये voyeuristic है. It's just exciting. Voyeuristic को excitement मिलती है ऐसे काम करके. ठीक है, उसको वैसे अदरवाइज कोई मसला नहीं होता, लेकिन उसकी feels very excited. ये voyeuristic है. A 40-year-old man is aroused by cross-dressing. He has been doing this for years, experiences no distress, and functions well socially and occupationally. What is the best diagnosis? Transvestic, gender dysphoria, paraphilia, no diagnosis, body mode dysmorphic.
Paraphilia.
Good. अब आहिस्ता आहिस्ता पिक हो गया. ठीक है, ट्रांसवेस्टिक में डिस्ट्रेस होगा, जेंडर डिस्फोरिया में भी बहुत डिस्ट्रेस होता है, और पैराफीलियस में उसको क्योंकि डिस्ट्रेस नहीं है तो उसको लेवल हम पैराफीलिया में डाल देंगे, बट इट्स नॉट अ डिसऑर्डर. अगेन वी हैव टू सी इफ द डिस्ट्रेस इज देयर. A 36-year-old man with pedophilic urges has never acted on them and is deeply distressed. Pedophilic tendencies are considered to be very, very offensive in this country where I'm practicing. Right? Pakistan में unfortunately कोई कानून सारे हैं, लेकिन again उस पे मसला है. So psychiatrically speaking, pedophilic tendencies हैं, लेकिन और उसको and is deeply distressed. He seeks help voluntarily. What is the most appropriate initial management? Report to law enforcement immediately. Start anti-androgen therapy, initiate SSRI and psychotherapy, no treatment needed, start antipsychotics.
So C.
Initiate SSRI and psychotherapy. A 50-year-old man engages, yeah, बोलो.
उसको लॉ इन्फोर्समेंट एजेंसीज को कब बताते हैं इसी केस में, अगर वो कोई
एक्ट कर जाए तो.
अगर एक्ट कर जाए, ठीक है.
अगर कोई अब he has a pedophilic urges, और अगर वो कुछ सोचना शुरू कर दे कि स्कूल के बच्चे हैं या स्कूल के आसपास मंडला रहा है या कोई ऐसी चीजें हैं और उसको डिस्ट्रेस जो है वो हो रहा है लेकिन वो कर रहा है, तो फिर आपको लॉ इन्फोर्समेंट को इन्फॉर्म करना जरूरी हो जाता है. राइट. ये अनफॉर्चुनेटली अगेन देयर आर समथिंग फ्यू थिंग्स डिफरेंट लीगली हियर एंड देयर. पाकिस्तान में हम लोग प्राइवेट प्रैक्टिस में अगर ऐसे कोई पेशेंट देते हैं हम लीगली इन्फॉर्म नहीं करते आइडियली. यहाँ पे अगर मेरा पेशेंट ये बताए मुझे कि मैं कल रात को घर से निकला था और मैंने ये हरकत की थी और ये करने के बाद मुझे बड़ा सुकून मिला, मजा आया, एंड दैट वी कंसिडर इट टू बी अगेन not a disorder but a problem, then we have to inform the law. A 50-year-old man engages in consensual bondage with his partner. He denies distress or impairment. His partner confirms full consent. What is the correct classification? Sexual masochism, sadism, paraphilia, personality disorder, no diagnosis.
No diagnosis.
9. Either be
पैराफिलिया.
paraphilia. Not a disorder, but paraphilia. Paraphilia का क्राइटेरिया पूरा हो रहा है लेकिन डिसऑर्डर नहीं है. Right? So, usko thoda sa careful. A 28-year-old man reports sexual arousal from rubbing against the strangers in crowded buses, which is a common phenomenon in our society. He has acted on these urges multiple times. What is the diagnosis? Voyeuristic, frotteuristic, exhibitionism, sexual sadism, paraphilia.
बी,
B.
फ्यूचरिस्टिक.
Absolutely. A patient with paraphilic disorder is treated with medroxyprogesterone. What is the primary mechanism? Dopamine blockade, increased serotonin, suppression of testosterone production, NMDA antagonism, GABA potentiation. अब इतनी तो समझ आ गई है. अब इतनी तो समझ आ गई है. एंटी एंड्रोजन थेरेपी, राइट? यस. सी. A 37-year-old man presents with compulsive sexual urges, repetitive intrusive thoughts about inappropriate acts. He finds them distressing and ego dystonic, and he has never acted on them, which is the most likely diagnosis. Paraphilia, OCD, pedophilic disorder, impulse control, antisocial. Anybody? Wild guess? 37 का है, कंपल्सिव सेक्सुअल अर्जेस हैं, रेपिटेटिव इंट्रूसिव थॉट्स हैं अबाउट इनअप्रोप्रिएट एक्ट्स, डिस्ट्रेसिंग हैं, ईगो डिस्टोनिक हैं. Nobody wants to say. It's not difficult, I believe. Is it? Anybody? नहीं? अच्छा, मैं बता देता हूं. This is OCD. ठीक है? ओके. आगे चलें. Are you people there? कनेक्शन डिसरेगुलेट तो नहीं हो गया?
Yes, sir.
ओके.
Yes,
मैंने
sir.
कहा शायद कनेक्शन डिस्कनेक्ट हो गया, आप लोग गायब हो गए. Okay, a psychiatrist is treating patient with a psychiatrist is treating a patient with pedophilic disorder who has previously offended. The patient admits to be undergo ongoing urges, vague plans involving a specific child. What is the most appropriate next step? Maintain confidentiality, increase SSRI dose, warn potential victim, breach of confidentiality, schedule closer follow-up, switch to psychotherapy only. This is again not very difficult. We have to warn the potential victim. and it's a breach of confidentiality as far as the psychiatry is concerned. A 31-year-old man reports sexual arousal from secretly observing others undressing. He is acting on these urges repeatedly without remorse and does not see a problem. OCD, voyeuristic, antisocial, paraphilia, delusional. And this is voyeuristic as well. Okay, last one. एक और करते हैं और फिर finish करते हैं. A 39-year-old man with known paraphilic disorder suddenly develops disorganized behavior, pressured speech, and risky sexual activity across multiple partners over 5 days. What is the diagnosis? Worsening paraphilia, bipolar mania, ADHD, substance use only, personality disorder.
Bipolar mania.
वेरी गुड, चलो गुड. ये सारे एमसीक्यूज मैं शेयर कर दूंगा. अब कोई और टॉपिक नेक्स्ट टाइम करना है तो मुझे बता दें. वैसे नेक्स्ट टाइम पीपल आर प्लानिंग टू हैव अ लॉन्ग केस, सो वील डू दैट इंशाल्लाह. बट अगर एमसीक्यूज करने हैं कोई खास तो बता दें. क्यों सुफियान साहब?
जी सर, मैं अगर वो बात ग्रुप में डिस्कस करके फिर बता देंगे अभी के फाइनल.
अच्छा, कोशिश करना मुझे जल्दी बता दो ताकि मैं तैयार कर लूं. ये एमसीक्यूज तैयार करने में थोड़ा सा टाइम लगता है. ठीक है
जी सर, थैंक
चलें. और लॉन्ग केस का भी डिस्कस करके मुझे अपडेट कर दें तो फिर नेक्स्ट फ्राइडे
जी सर.
8 बजे, फ्राइडे को 8 बजे कर लेंगे. 7 या 8 बजे कर लेंगे वो
ठीक
लॉन्ग केस. ओके, थैंक यू वेरी मच
ठीक हो गया.
एवरीवन. टेक केयर.
थैंक यू सो मच
अल्लाह
सर.
हाफिज. अल्लाह हाफिज.